Hello everyone, welcome back to my YouTube channel Midcode Education. So in this video I am going to covering our homeworks. Okay, I already uploaded some in my previous live ICD related questions and also ICD related basic knowledge. Okay, so that is our first session. Now we are moving on to the homeworks. I already uploaded some homework questions. First of all, fever. What is the code of fever? R50.9 is the code of fever. Okay, R50.9. And also some more homeworks are the pneumonia. Pneumonia's code J18.9. Okay, J80.9 is pneumonia's code. And headache. Headache code R51.9. Um, you check, guys. I think all students are attended the homework and try to correct the, if you are entering in a wrong code, try to correct. Okay, check your answers. Okay, I will upload all the questions answers in this video. So headache R51.9. Also tonsillitis. Tonsillitis means J03.90. Tonsillitis. And jaundice. Jaundice means R70. Jaundice. And gastritis. K29.70. Okay. K29.70. Mm, hemorrhage. Hemorrhage R58. R58. Okay. And hepatitis K75.9, sepsis A74, A41.9, nausea R11.0, pain R52, lipoma D17.9, and obesity E66.9, hematuria R31.9. Mm, and tachycardia R00 point 0, right? And next is myofibrosis M62.89, rubella B06.9, bedridden is at 74.01, calcinosis E83.59, fatigue R53.83, and rabies A82.9, HIV B20, keratitis at 60.9. So these are the basic one term codes, one term disease. And this is two term typhoid fever. So check in the fever uh, and move on to typhoid, or otherwise you can directly take the code T. Under the T you can see typhoid fever. A01.00 is the typhoid fever. Okay, and lot of homeworks are there. Stomach ulcer K25.9, heart failure I50.9, renal failure N20.0, nasal polyp J33.9, abscess of liver K75.0, hepatic failure K72.90, Cushing syndrome E24.9, senile keratosis L57.0. And others are three terms. Okay, you check it down, guys. I hope everyone write this homeworks and also the answers. If you are not entered the homework or not attended the homework, you can just check in my previous video. I have uploaded homeworks, so you can just identify the correct answer of the particular homeworks. Okay, I have one student talk me about that. Ma'am, please give me some questions only, not the answers. We are trying to trying to do answers in on self in ourself. Okay, so I think this is helpful for all students. Try to practice yourself with the mock homework or questions. Okay, so I have already uploaded the questions only part in the previous video. Check the video just behind the video. Okay, I have taken at the 12 p.m. Live. I'm okay. I will do a live at the 12 p.m. today. So just check the previous video. You can see some questions, some more questions. Okay, so that questions answer is I am taking in this video. Clear? Some homeworks. Mental health evaluation is at 0.8. High risk infant is at 76.2. Okay, and some four terms: thoracic descending aortic rupture, I 71.13. Homework: upper left ulcerative blepharitis, H01.014. Drug induced hemolytic disease, D59.0. Male genital organ system, N50.9. Cardiovascular pre-procedural system, EZ01.810. And yeah, next is related to cholecystitis, C calculus, gallbladder. I have already told you that. So this is the way of taking the cholecystoliasis. Okay, first of all, you have to take the alphabet C. Under the C, you can see CH alphabets. Under the CH, you can see cholecystiolysis. And straight opposite, they have mentioned C calculus and also gallbladder. So you have to take calculus in the alphabetic index, then move on to gallbladder. You can get a code K18.20. Check it within the tabular list. Okay, so you will get the correct answer. Next, gastric ulcer, K25.9. Blood loss, R58. Recurrent fever, A68.9. Okay, and some more questions. Capillary angioma, so C also they have mentioned. C also hemangioma. Other name of capillary angioma they have mentioned hemangioma. Okay, hemangioma is also called capillary angioma. For example, cardiac arrest, heart attack, both are same. Okay, so you can see cardiac arrest or otherwise heart failure, heart attack, whatever. Okay, I 78.1 is the correct answer. And arteriosclerosis I 17.90, stenosis of fallopian tube N 97.1, and skin boil L02.828. So this skin boil means skin boil, or otherwise burnt. Okay, so we can just see boil, not only skin. Okay, skin is a location. So not to search any location, you have to search the particular disease first of all. So boil, take alphabet B and C boil. So they have mentioned C also. A furuncle, okay, in specified size NEC. So check furuncle and you have seen a specified site NEC. Okay, our site is skin, then move on to skin. We will get a answer. Okay, so this is an L02.828. Okay, so try to take the code your own self, dears. And acute kidney failure with tubular necrosis, A17.1. And also one it's a tick mark related question, incomplete code. Okay, so cholesteatoma phatic right ear is an incomplete code, H71.1 is the code. And another homework, cellulitis of right finger is also incomplete code, LOL03.011. And it's the essential modifier means Alzheimer's disease. So G30.9, F note 2.8. So both codes are reported and remove brackets. Okay, you can report both the codes. Next homework, A50.08, K77, both are same. Okay, amyloid heart diseases, E85.4, I43. Okay, And malignant hypertension I10. Next, diabetes mellitus E11.9. So the direct questions. Okay, next is look at this infantile anemia D64.9, hereditary B, ataxia G11.9. Next is combination code. Um, Combination code means two codes combined together, you will get a single code. So this is called combination code. Okay. So nausea with vomiting. So both are a combination code. The combination code is R11.2. Okay. You can check it with nausea with vomiting. Okay. Nausea and you will get a proper code. Okay. R11.2. And also some more homeworks are the diabetic mellitus with chronic kidney disease E11.22. Okay, and anemia due to chemotherapy D64.81. Multiple codes. What is multiple codes? Multiple codes means it is used for more than one codes. Okay, it is used for more than one code. So two or more codes are called multiple codes. Okay, so here a question is rhinitis with the dyspnea. Okay, J31.0, R 06.00. So this is the correct answer. Okay, then move on to next. Yeah, next one is related to initial encounter, subsequent encounter, and sequel are related. Okay, I have already told you about that. We have a seventh character called ADS. A is for initial encounter, D is for subsequent encounter, and S for sequela. So here the question contusion of liver initial encounter. They have mentioned initial encounter. Okay, contusion of liver has initial encounter. So it's a direct question. So you have to take direct code for reporting initial encounter. You can use A alphabet. Okay, so the seventh character will be A. Look at this 1, 2, 3, 4, 5, 6, seventh one. Seventh one is A. Seventh one is an initial encounter. A character alphabets. Okay. And next question is a homework. A patient visited first time for treatment of open wound ankle injury and left side. So this is also an initial encounter statement because here the physician not directly mentioned initial encounter. They have mentioned the condition only. A patient visitor for first time. So in every report, a patient is visited the hospital first time for a treatment. You can take A as an initial encounter. Okay, first time visit, first time admission, first time visit is represented the alphabets A. Okay, and the alphabet S, sorry, D. D means subsequent encounter is for a follow up or checkup care. S for late effect. Okay, so in this case, the patient is visited first time for a treatment. So take appropriate A for a seventh character. Clear? So S91.002A is the seventh character. And next is placeholder. We use in ICT 10CM placeholder as X alphabet. X is the placeholder, and X can be used before seventh character. Okay, cannot be used as the seventh character. It can be used before X, before seventh character. Okay, so here look at this S03.41, and there is a blank space. Not leave it empty. You can use X and D. Okay. XA, XD, XA, XA, XA. Okay. So first visit for the treatment of crushed chest. So first visit means initial encounter. So put seventh character as A, and other codes are XX. Clear? And this also first time. So put A. And second time visit. So second time it means it's a follow up or checkup. So you can use D character as a seventh character, and before not leave it blank. So put XX. Okay. And pressure ulcer of shoulder. Check all others codes also. Okay. Pressure ulcer of shoulder, NECL 89.899. So it's the pressure ulcer of shoulder. NOS, not otherwise classified. Pressure ulcer. So you can take ulcer and then check pressure. Pressure ulcer L89.90. And acute and chronic salpinginitis. So here they have mentioned acute and chronic both conditions. So you can code both the condition, acute and chronic also. So separately. Okay, N70.01 is for acute. Uh, okay. And next is acute code first. Okay, and then next is chronic. I think I explained in our previous video this. Okay, questions homeworks only. Okay. Yeah, this is enough for today, guys. I will be back on part 2 video related to ICD 10CM. So stay tuned for more videos. And if you have any doubts or inquiry related to medical coding, you can directly contact me. My email ID is medicalcoding10@gmail.com. Okay, guys, see you tomorrow. Bye bye.